What if I told you that some of the most effective remedies ever used by human beings are not in any pharmacy, not behind any prescription counter, and not in any supplement aisle, and that some of them were still being used in hospitals within living memory, before they were quietly replaced by more profitable alternatives? Before pharmacies existed, before clinical trials were invented, before anyone had named a single bacterium, people healed themselves. They healed infections, they healed wounds, they healed chest colds and sleepless nights and joint pain and digestive disorders. And they did it with preparations that most people today have completely forgotten. Today I am going to walk you through 20 of those forgotten remedies. Not just the plants, the actual preparations, what went into them, how they were made, why they worked, and in several cases, what modern research has confirmed about the mechanisms that traditional healers understood through observation alone, starting with the one that survived the Black Death. Stick around because number 2 on this list is a preparation whose primary active compound is still used by dentists today, and most of their patients have no idea the origin of what is being applied to their gums. And number 5 was used in hospital emergency protocols within the last century, before pharmaceutical companies found something more billable to replace it. Number 1. Vinegar of the Four Thieves. The antimicrobial preparation that, according to historical record, allowed a group of thieves to rob the bodies of plague victims during the Black Death without contracting the disease, and that modern laboratory analysis has confirmed contains compounds with genuine antimicrobial activity against the organisms responsible for that epidemic. The legend is well documented across multiple European sources. During the Great Plague outbreaks of the 14th through 18th centuries, a group of thieves robbed the homes and bodies of plague victims without becoming infected. When caught and brought to trial, they were offered leniency in exchange for their secret. The preparation they described was a vinegar steeped with a combination of herbs. Most accounts include rosemary, sage, lavender, thyme, rue, and garlic, that they applied to their bodies, their clothing, and around their mouths and noses before approaching infected areas. Modern pharmacological analysis of the primary compounds in these herbs, thymol from thyme, rosmarinic acid from rosemary, camphor from lavender, allicin from garlic, confirms that each of these compounds has documented antimicrobial activity. Thymol is the active ingredient in Listerine mouthwash and in several pharmaceutical antiseptics. Allicin from garlic has demonstrated activity against Yersinia pestis, the bacterium responsible for bubonic plague, in laboratory studies. The preparation worked not through magic or luck, but through the antimicrobial chemistry of the plants involved, understood empirically by the people using it long before anyone had a microscope. Make it by steeping the dried herbs in raw apple cider vinegar for 4 to 6 weeks, straining and storing in dark glass. Use as a household antiseptic wash or diluted as a gargle. Number 2's primary active compound is something that has never left medical practice. You have almost certainly had it applied to your gums by a dental professional. You probably did not know that what they were using came from a flower bud that traditional medicine was using for toothaches in the same way for thousands of years before dentistry existed as a profession. Number 2. Clove oil, whose primary compound eugenol is still used in modern dentistry as a local anesthetic and antiseptic, applied to exposed nerves and infected gum tissue in dental offices worldwide. Derived from the same dried flower buds that traditional medicine across Asia, the Middle East, and Africa used for toothaches for over 2,000 years. Syzygium aromaticum. Eugenol, the compound that gives cloves their distinctive aroma, is a legitimate local anesthetic. It blocks the sodium channels that transmit pain signals from dental nerve tissue. Dentists use it in zinc oxide eugenol cement for tooth restoration, in root canal sealers, and as a direct application to exposed nerve tissue during dental procedures. The traditional use was direct and immediate. Press a whole clove against an aching tooth, or apply a drop of clove oil to the gum with a cotton ball, and within minutes the numbing effect begins. Traditional healers across Asia and the Arab world had been doing exactly this for millennia. Clove oil also has documented antimicrobial properties. Eugenol inhibits the growth of the bacteria most commonly associated with dental infections. The traditional application was simultaneously anesthetic and antimicrobial. Dentistry eventually isolated eugenol, synthesized it at scale, and integrated it into professional formulations. The source remained the same dried flower bud. A drop of quality clove essential oil on a cotton ball applied directly to a painful tooth, or inflamed gum provides immediate relief through the same mechanism that the dentist's material uses. Your grandmother was not practicing folk medicine when she reached for the cloves. She was applying pharmaceutical-grade eugenol in its original delivery format. Number 3. Oxymel, the preparation of honey and vinegar that Hippocrates prescribed for acute respiratory illness approximately 2,400 years ago, that dissolves thick mucus through the acetic acid mechanism, and that delivers antimicrobial and anti-inflammatory compounds from both components simultaneously. Oxymel, from the Greek oxys meaning sour and meli meaning honey, is one of the oldest documented medical preparations in Western history. Hippocrates prescribed it specifically for respiratory illness accompanied by thick mucus and cough. The mechanism is real. Acetic acid from the vinegar directly dissolves mucin polymers, the protein chains that give thick mucus its viscosity, making it more fluid and easier to clear from the respiratory tract. Honey contributes its own antimicrobial properties through hydrogen peroxide production and its exceptionally low water activity that creates an inhospitable environment for bacterial survival. Together, the two components address the primary symptoms of upper respiratory illness, congestion, infection, and productive cough, through separate but complementary mechanisms. Traditional herbalists often added thyme, ginger, or elecampane root to the base preparation to extend the antimicrobial and expectorant action. The preparation is simple. Combine raw local honey and raw apple cider vinegar in equal parts. Heat gently until combined, add herbs if desired, steep, and strain. A tablespoon taken 3 times daily during respiratory illness. This is the preparation Hippocrates prescribed. It has not been improved by 2,000 years of pharmaceutical development. It has only been replaced by more profitable alternatives. Number 4. Fire cider, the immune system tonic that traditional herbalists called scorched earth medicine, combining the most potent antimicrobial ingredients available in any kitchen into a single preparation taken at the first sign of infection. When the goal is to make your body an inhospitable environment for whatever is trying to establish itself. Fire cider is not a single traditional recipe. It is a category of preparation that appears across multiple folk medicine traditions under different names. The principle is consistent. Take the most aggressively antimicrobial ingredients available, steep them together in raw apple cider vinegar for 4 weeks, strain, sweeten with honey, and take by the tablespoon. The standard combination includes fresh horseradish root, whose sinegrin breaks down to allyl isothiocyanate with powerful antimicrobial and decongestant activity, raw garlic for allicin, fresh ginger for ginger rolls, onion for quercetin and additional antimicrobial sulfur compounds, hot peppers for capsaicin with its vasodilating and antimicrobial properties, and sometimes turmeric for curcumin. Each ingredient has documented individual antimicrobial activity. Combined in an acidic base that extracts and preserves the active compounds, the preparation addresses infection through multiple simultaneous mechanisms. Traditional herbalists took it preventatively through winter and therapeutically at the first sign of illness. The heat you feel when you take it is the vasodilation that increases blood flow to mucous membranes, exactly where you want immune activity concentrated during a respiratory infection. Make it in September. Take it through winter. The scorched earth approach to immune support that your great-grandmother understood intuitively. Number 5. Activated charcoal, used in hospital emergency protocols for poisoning and overdose through the 20th century, with documented absorption capacity that binds toxins in the gastrointestinal tract before they can be absorbed, and a history of medical use stretching from ancient Egypt through documented clinical application within living memory. Charcoal produced from bone, wood, or vegetable matter was used medicinally in ancient Egypt, in Hippocratic medicine, and in traditional systems across Asia and the Americas for what healers described as internal poisoning, bad food, and digestive corruption. What they were observing, now without the biochemical language, was adsorption. The extraordinary capacity of activated charcoal's porous surface to bind toxins, bacteria, and harmful compounds in the gastrointestinal tract before they can be absorbed into the bloodstream. Activated charcoal is still used in hospital emergency departments today for certain poisonings and overdoses. The mechanism is too effective to abandon. It was more widely used in emergency medicine through the mid-20th century, before specific pharmaceutical antidotes replaced it for many applications. Traditional use of plain wood or bone charcoal for digestive upset, food poisoning, and intestinal distress was observationally correct about the mechanism. Activated charcoal is not the same as the charcoal from your barbecue grill. It requires specific production processes to create the porous surface structure that enables adsorption. Food-grade activated charcoal is available, and the traditional applications for acute digestive distress and food poisoning have genuine mechanistic support. This is a remedy that hospitals still use in specific contexts, and that your ancestors were using for the same reasons with the same underlying mechanism for thousands of years. Number 6. Mustard plaster. The Victorian chest remedy applied externally over the lungs during bronchitis and pneumonia, whose sinigrin compound converts on contact with water to allyl isothiocyanate that penetrates skin and stimulates blood flow to the chest wall, increasing local immune activity and loosening congestion from outside. Before antibiotics, a chest infection was a serious and potentially fatal condition. Victorian households, and households before them going back centuries, had a standard response for deep chest congestion: the mustard plaster. Ground mustard seeds mixed with flour and water to a paste, spread on cloth, applied to the chest wall and upper back for 15 to 20 minutes. The active mechanism: sinigrin in the mustard seed converts to allyl isothiocyanate when exposed to moisture. This compound penetrates the skin, stimulates local vasodilation, increased blood flow to the area, and produces the characteristic warming sensation that confirms the mechanism is working. The increased circulation to the chest wall brings immune cells to the area and loosens the tight congestion of the bronchial passages beneath. Traditional practitioners understood that the plaster must not remain on the skin too long, 15 to 20 minutes maximum, because the same mechanism that stimulates healing can cause blistering if prolonged. Children required shorter applications and a barrier layer between the plaster and skin. The preparation was applied 2 to 3 times daily during acute chest illness. Physicians in the pre-antibiotic era prescribed it alongside rest and steam inhalation. The mechanism is real. The remedy works. It simply requires ingredients from the kitchen cabinet rather than a prescription pad. Quick pause. If what we are covering today is making you think seriously about building a practical home apothecary with preparations like these, there are 3 complete guides in the first pinned comment below. A step-by-step guide to the most powerful medicinal plants and preparations for home use, 30 protocols with exact dosage and safety notes, and a complete home apothecary system. There is a bonus inside that most people do not expect. Link is pinned below. Now let us keep going. Number 7. Elderberry syrup. The Victorian pantry staple made every autumn from wild harvested elderberries, whose primary flavonoids inhibit neuraminidase by the same mechanism as Tamiflu, the antiviral drug that costs over $100 per course of treatment. Sambucus nigra berries were harvested every autumn by households across Europe and North America and simmered into a thick, dark syrup with honey and spices that was stored through winter and taken by the spoonful at the first sign of influenza. The tradition was continuous and consistent across cultures that had no contact with each other. Modern pharmacological analysis has found that elderberry flavonoids, particularly cyanidin-3 and cyanidin-3 sambubioside, inhibit neuraminidase, the enzyme that influenza viruses use to break free from infected cells and spread to new ones. Block neuraminidase, and you contain the infection. This is the mechanism of oseltamivir, sold as Tamiflu. A meta-analysis of randomized controlled trials found that elderberry supplementation significantly reduced the duration and severity of influenza compared to placebo. The Victorian household that made elderberry syrup every autumn was producing a preparation with documented antiviral activity against the exact pathogen that most threatened them during winter. The drug company found a way to charge significantly more for a synthetic version of the same mechanism. The elderberries are in the hedgerow. The preparation takes 30 minutes. Do not eat raw elderberries. The sambunigrin compound in raw berries causes nausea. Always cook elderberries before consuming. Number 8. Thyme honey syrup, whose primary compound, thymol, is the active ingredient in Listerine mouthwash and in pharmaceutical cough preparations still sold in European pharmacies. With a German Commission E monograph formally recognizing thyme preparations for bronchitis and upper respiratory catarrh. Thymus vulgaris. Thymol and carvacrol, The volatile phenolic compounds in thyme have documented antimicrobial activity against the bacteria most commonly responsible for secondary respiratory infections, and expectorant activity that helps loosen and move mucus from the bronchial passages. Thymol is not a folk claim. It is the active ingredient in Listerine, in several pharmaceutical antiseptic preparations, and in botanical cough syrups still sold over the counter in Germany, Switzerland, and across continental Europe, where botanical medicine regulatory frameworks are more sophisticated than in the United States. The German Commission E, the regulatory body that evaluates herbal medicines, formally approved thyme preparations for bronchitis and upper respiratory catarrh based on the evidence. The traditional preparation is simple. Steep several generous sprigs of fresh thyme in near boiling water, covered for 10 minutes. Strain. Stir in raw honey while still warm. Take by the tablespoon every few hours during respiratory illness. The honey adds its own antimicrobial and soothing properties. The thymol is doing the pharmacological work that the pharmaceutical cough syrup on the shelf is charging $15 to provide from a synthetic source. Fresh thyme is in most grocery stores. The preparation takes 10 minutes. Number 9. Garlic in honey. The preparation that preserves allicin in an antimicrobial medium, with laboratory studies documenting activity against methicillin-resistant Staphylococcus aureus, MRSA, the antibiotic-resistant strain that conventional medicine has struggled most to control. Raw garlic produces allicin when the clove is crushed or chopped. The enzyme alliinase converts alliin to allicin on contact with air and moisture. Allicin is unstable and degrades quickly in most environments. But raw honey's low water activity and hydrogen peroxide content preserve allicin significantly longer than leaving garlic exposed to air alone. The combination also addresses the primary limitation of raw garlic as a medicinal preparation: the taste. Fermented in raw honey for several weeks, whole garlic cloves mellow dramatically, while the allicin is preserved, and the honey itself absorbs the antimicrobial compounds from the garlic. Laboratory research has documented allicin's activity against MRSA, methicillin-resistant Staphylococcus aureus, the bacterial strain that has caused serious concern in clinical settings precisely because conventional antibiotics have lost effectiveness against it. Traditional medicine across every culture that cultivated garlic used it specifically for infections. The mechanism was observed long before allicin was identified. Submerge whole peeled garlic cloves in raw local honey. Leave for a minimum of 1 week before use. The garlic becomes mild and delicious. The preparation keeps for months. Take 1 to 2 cloves daily through winter as a preventative preparation. Number 10. Bone broth as medicine. The preparation that traditional medicine across every culture prescribed for recovery from illness, wound healing, and gastrointestinal distress, delivering glycine, proline, and gelatin that support gut lining integrity through the same mechanisms that modern IV nutritional support attempts to replicate at significant expense. Before intravenous nutrition existed, before hospital feeding tubes existed, before any technology for delivering nutrients directly to the bloodstream had been developed, physicians prescribed one preparation above all others for patients too ill to eat: long-simmered bone broth. The rationale, understood empirically across every medical tradition, was that broth made from bones and connective tissue was the most digestible, most restorative, most healing preparation available. Modern nutritional biochemistry has mapped the mechanism. Extended simmering of bones and connective tissue releases collagen as gelatin, which further hydrolyzes into the amino acids glycine and proline. Glycine is the primary fuel for enterocytes, the cells lining the intestinal wall. When the gut lining is compromised by illness, stress, or infection, glycine from gelatin-rich broth directly feeds the repair process. The gut lining is also the primary site of immune system activity. Restoring its integrity is not a peripheral benefit of bone broth. It is the central mechanism of why every traditional medical system reached the same preparation independently. Simmer bones, ideally with a splash of apple cider vinegar to draw minerals from the bone matrix, for 12 to 24 hours. The resulting broth is not a recipe. It is a delivery system for the compounds that rebuild from the inside out. Number 11. Pine needle tea. The preparation that prevented scurvy in populations cut off from fresh food during winter, containing vitamin C in concentrations that early European explorers learned about from indigenous peoples, when their own crews were dying of the deficiency disease that pine needle tea cured within days. Jacques Cartier's expedition to Canada in 1536 is one of the most documented cases of emergency botanical medicine in history. His crew was dying of scurvy, the vitamin C deficiency disease that causes collagen to literally fall apart, resulting in bleeding gums, reopening of healed wounds, joint pain, and eventually death. The local Iroquois peoples showed Cartier's men how to prepare a tea from the needles and bark of a conifer they called anada, most likely white cedar or eastern white pine. Within days of beginning the treatment, the crew members who had been expected to die were recovering. The vitamin C content of fresh pine needles is real and significant. Some species contain concentrations comparable to citrus fruit. During winter, when fresh food was unavailable and scurvy threatened communities cut off from fresh vegetables, pine needle tea was a survival preparation. The knowledge was practical and specific. Fresh green needles from non-toxic pine species, steeped in water just below boiling. Not a rolling boil, which destroys vitamin C, covered to prevent volatile loss for 5 to 10 minutes. Important safety note, avoid needles from yew, Norfolk Island pine, or cypress species. Eastern white pine, Scots pine, and spruce are the traditional preparations. The remedy that saved Cartier's crew is free in most temperate forests. Number 12. Willow bark tea, the original aspirin used for pain, fever, and inflammation for at least 3,500 years, containing salicylates that the pharmaceutical industry isolated, synthesized, and sold back to the world while removing the gastroprotective compounds that surrounded them in the original plant. Salix alba. Willow bark has been used for pain and fever reduction across Egyptian, Greek, Roman, Chinese, and Native American medicine for millennia. The first recorded use appears in ancient Sumerian clay tablets. In 1828, the active compound salicin was isolated. In 1897, Felix Hoffmann at Bayer synthesized acetyl salicylic acid, aspirin, from it, and named it in part from Spirea ulmaria, the meadowsweet plant containing similar salicylates. What the pharmaceutical process removed was everything surrounding the salicylates in the original plant. The mucilaginous compounds in meadowsweet that protect the stomach lining, the tannins in willow bark that moderate absorption rate, the full spectrum of phenolic compounds that work synergistically with the salicylates. Willow bark tea acts more slowly than aspirin because absorption is gradual rather than immediate. It produces less gastric irritation because the plant matrix moderates the salicylate delivery. Traditional use was for fever during infection, joint pain in chronic inflammatory conditions, and headache. Steep 1 to 2 teaspoons of dried willow bark in boiling water for 10 minutes. The taste is bitter and astringent. It works. And it does not damage the stomach lining the way isolated aspirin can with regular use. Number 13. Yarrow styptic, the field hemostatic that soldiers of every army in the ancient world carried specifically to pack into wounds and stop bleeding, whose achyletin compounds measurably accelerate platelet aggregation, and that remains the most practical emergency bleeding control preparation available from any wild plant. Achillea millefolium. The Latin name carries the entire history. Achilles, who according to classical tradition, used yarrow to treat the bleeding wounds of his soldiers during the Trojan War. Whether that specific attribution is historical or mythological, the practical reality is documented across 2,000 years of military medicine. Yarrow was standard field kit, dried and carried specifically for packing into wounds to control bleeding. In armies across Europe, Asia, and the Americas that had no contact with each other. The mechanism is confirmed in modern research. Yarrow contains achyletin and other compounds that promote platelet aggregation, the mechanism of clot formation, measurably reducing bleeding time. It is simultaneously a vulnerary. The anti-inflammatory and antimicrobial compounds in the plant support tissue repair after the bleeding stops. Most plants perform one function well. Yarrow performs both. The practical preparation requires nothing. Crush fresh yarrow leaves or use dried herb moistened with clean water and apply directly to a wound with firm pressure. The bleeding slows within minutes. For anyone who spends time outdoors, knowing yarrow by sight is practical first aid knowledge with a 2,000-year field-tested track record. Number 14. Calendula salvae, the war flower preparation carried by medieval soldiers for battlefield wound care, proven in modern clinical trials to accelerate healing in burns and surgical wounds. and still being formulated by pharmaceutical-grade cosmetic companies who quietly list the same extract their marketing calls innovative. Calendula officinalis. Medieval soldiers called it the war flower because when you had no surgeon, no antiseptic, and no sterile equipment, a poultice or salve made from calendula flowers could prevent a wound from becoming infected and keep it healing clean. The triterpenoids and flavonoids in the flowers have confirmed anti-inflammatory and antimicrobial properties. Allantoin in the flower promotes cell proliferation, accelerating tissue repair. Modern clinical trials confirm what the battlefield tradition established. Calendula extracts significantly speed wound healing, including burns and surgical incisions. The commercial cosmetic industry uses calendula extract in premium skincare products marketed at considerable markup. The source plant grows from spring through frost in virtually any garden, costs almost nothing to cultivate, and produces flowers continuously. A calendula salve requires 3 things: dried flowers infused in a carrier oil for 4 to 6 weeks, the strained oil, and beeswax melted into it at roughly 1 part beeswax to 8 parts oil. Pour into tins while liquid. That preparation, made in an afternoon, is what medieval surgeons had, what modern clinical trials have validated, and what the cosmetic industry sells back in elegant packaging. Number 15. Plantain poultice, the emergency first aid preparation made from the weed growing in every lawn and sidewalk crack, whose aucubin and allantoin compounds reduce inflammation, slow bleeding, and inhibit bacterial growth within minutes of application, proven in a 2015 clinical trial to outperform standard pharmaceutical treatment on second-degree burns. Plantago major. The preparation requires no equipment and no preparation time. Find a plantain leaf, the low-growing weed with oval-ribbed leaves that grows in virtually every disturbed soil environment on Earth, crush it or chew it briefly to break the cell walls and apply directly to the affected area. Within minutes, the cooling, anti-inflammatory effect is measurable. The compounds aucubin and allantoin are activated when the cell walls are broken. Aucubin reduces inflammatory signaling. Allantoin promotes cell proliferation for tissue repair. Both have antimicrobial properties. A 2015 clinical trial in Iran found that plantain ointment outperformed standard pharmaceutical treatment on second-degree burns, a result that would generate significant attention and considerable investment if it emerged from a synthetic compound in a pharmaceutical company's pipeline. Because it came from a common weed, most people have never heard of it. The people who know plantain on site reach for it the moment someone gets stung, burned, or cut. The first aid kit that follows you wherever you walk has always been there. Number 16. Comfrey poultice, external use only, containing allantoin that promotes cell proliferation at rates that multiple peer-reviewed clinical trials have confirmed significantly reduce pain and improve function in sprains, bruises, and muscle injuries, while carrying a critical safety note that must be understood before use. Symphytum officinale, knit bone. The folk name describes the observed outcome with a directness that most pharmaceutical product names do not attempt. For centuries, people applied comfrey root poultices and salves to sprains, bruises, torn muscle, and slow-healing soft tissue injuries and observed that healing happened faster. The mechanism? Allantoin in the root promotes cell proliferation, literally accelerating the rate at which damaged tissue repairs itself. Multiple peer-reviewed clinical trials published in journals including Phytomedicine have confirmed that topical comfrey root extract significantly reduces pain and improves function in ankle sprains, back pain, abrasions, and osteoarthritis. These are controlled trials with placebo comparisons, not anecdote. The safety note is non-negotiable. Comfrey contains paralizidine alkaloids that cause liver damage when consumed internally over time. External use only. Applied as a salve or poultice to the skin over an injury, comfrey is both safe and effective. Consumed as a tea or taken internally in any form, it is not. This is the distinction that responsible herbal medicine has always made, and that any source treating comfrey as universally safe is failing to communicate. External application. One of the most clinically validated topical botanicals available. The name earned by observation over centuries. Number 17. Ginger compress, the Japanese and Chinese therapeutic preparation applied externally to painful joints, tight muscles, and congested organs. Using gingerols and shogols to penetrate the skin, and stimulate deep circulation in ways that topical pharmaceutical analgesics attempt to replicate through synthetic vasodilating compounds. Traditional Japanese medicine, or particularly the macrobiotics tradition, used the ginger compress as a primary external treatment for joint pain, muscle tension, kidney support, and deep organ congestion. The preparation: grate a significant amount of fresh ginger root into water brought just below boiling. Steep for several minutes. Wring a towel in the liquid while it is as hot as can be comfortably tolerated. Apply to the affected area. Cover with a dry towel to retain heat. Replace as the compress cools. Repeat for 15 to 20 minutes. Gingerols and shogaols, the active compounds in fresh and dried ginger respectively, penetrate the skin on contact and stimulate local vasodilation, increasing blood flow to deep tissue in ways that surface-level warming alone does not achieve. The traditional understanding was that stagnant circulation was at the root of pain and dysfunction in tissue, and that stimulating movement in that circulation was the therapeutic intervention. Modern sports medicine uses heated preparation and massage for exactly the same mechanistic reason. The ginger compress adds the pharmacological activity of the gingerols to the thermal effect of the heat. Applied to arthritic joints, tight lumbar muscles, or congested sinuses, it is a genuinely different experience from a standard hot pack. Number 18. Onion poultice, the Victorian chest remedy for bronchitis and pneumonia applied externally over the lungs, whose sulfoxide compounds penetrate the skin and reach the underlying tissue, producing the vasodilating and expectorant effects that traditional practitioners observed, clearing tight chest congestion within hours. Allium cepae. The onion poultice appears in the domestic medicine literature of virtually every European and American household manual published between 1800 and 1940. The preparation: slice or gently heat onions and apply wrapped in cloth to the chest and upper back, held in place while the patient rests. The mechanism that traditional practitioners observed and that modern phytochemistry has partially explained. The volatile sulfoxide compounds in onion, the same compounds that make eyes water when cutting them, are sufficiently volatile to penetrate skin and reach underlying tissue, where they produce vasodilation and increase local circulation. Applied externally over the chest during bronchitis or pneumonia, the increased circulation to the bronchial area supports immune activity and helps loosen congested mucus. The warmth of the heated onion adds the thermal vasodilation effect. Pediatric folk medicine used onion poultices for children's chest colds with particular consistency, the preparation being gentle enough for children while still effective. The remedy disappeared from domestic medicine handbooks with the arrival of pharmaceutical antibiotics and the cultural shift away from home preparation of any kind. The onions are in the kitchen. The preparation takes 5 minutes. The mechanism has not changed. Number 19. Turmeric golden paste, the preparation developed by traditional Ayurvedic and Thai cooking that combines turmeric with black pepper and fat in the exact proportions that modern pharmacokinetic research has confirmed maximize curcumin bioavailability, 2,000% beyond what isolated curcumin achieves alone. Curcuma longa. Curcumin, the primary active compound in turmeric, has been studied extensively across every inflammatory disease category and has disappointed in clinical trials for a reason that traditional cuisine had already solved: bioavailability. Curcumin taken as an isolated supplement is poorly absorbed, metabolized quickly, and reaches target tissues in concentrations too low to produce the effects seen in laboratory studies. Traditional Ayurvedic medicine and traditional Thai and Indian cuisines solved this problem empirically. They never ate turmeric without fat and black pepper. Research published in Planta Medica confirmed that piperine, the active compound in black pepper, increases curcumin bioavailability by approximately 2,000% through inhibition of glucuronidation, the metabolic process that otherwise rapidly eliminates curcumin from the body. Dietary fat increases absorption through the lymphatic system rather than direct portal circulation, bypassing first-pass liver metabolism. The golden paste preparation, turmeric combined with black pepper, and a quality fat like coconut oil or ghee, gently heated to combine, is the traditional delivery format that achieves pharmacologically relevant concentrations in target tissue. The supplement industry sells curcumin tablets without pepper and fat and wonders why the results disappoint. Traditional cooking encoded the solution. It just did not explain why. Number 20. Valerian tincture, The preparation that traditional European medicine prescribed for anxiety, insomnia, and nervous tension for over 1,000 years, containing valerianic acid that modulates GABA-A receptors through the same receptor class targeted by benzodiazepine pharmaceuticals, and that multiple clinical trials have confirmed reduces sleep latency and improves sleep quality in people with insomnia. Valeriana officinalis has been prescribed as a sedative and anxiolytic in Western medicine since at least the 2nd century. Galen prescribed it for insomnia. Medieval European monasteries cultivated it in their medical gardens alongside other essential herbs. Traditional preparation was as a tincture. The root steeped in alcohol, which extracts the valerianic acid and other sesquiterpene compounds more efficiently than water. Valerianic acid interacts with GABA-A receptors, the same receptor class that benzodiazepine drugs like diazepam act on. The difference is specificity and side effect profile. Valerian's interaction is partial and modulatory rather than the full agonist activity of pharmaceutical benzodiazepines, which produces the desired sedative effect with a significantly lower risk of the dependence, rebound insomnia, and cognitive impairment that benzodiazepines carry. Multiple randomized controlled trials have confirmed that standardized valerian extract reduces sleep latency, the time to fall asleep, and improves subjective sleep quality compared to placebo in people with insomnia. The effects are not immediate. Consistent use over 2 to 4 weeks produces the most reliable results. The traditional tincture is made from dried valerian root steeped in alcohol for 4 to 6 weeks and strained. The smell is not pleasant. The effect, used consistently, is real. The plant that traditional medicine called the Valium of the plant kingdom earned that comparison through 1,000 years of consistent observed outcomes before anyone understood receptor pharmacology. Modern research eventually found the mechanism. The remedy was already there. 20 preparations, all of them forgotten, all of them documented. Several of them validated by the same clinical trial methodology that validates pharmaceutical drugs, none of them profitable enough to advertise. Before pharmacies existed, people did not simply suffer through illness and hope for the best. They had a sophisticated, empirically refined body of knowledge about how to prepare what grew around them into effective medicine. That knowledge was displaced, not disproven. The preparations are available. The ingredients are in most kitchens and gardens. What was lost was simply the knowledge of what to do with them. For anyone who watched all the way through, and the complete practical guides to making and using preparations like these at home are in the first pinned comment below with the bonus inside. Use the code FULLVIDEO at checkout for 20% off. The link is pinned whenever you are ready. Hit the like button if this changed what you see in your kitchen. Drop a comment and tell me which remedy surprised you most. Subscribe and ring the bell. I will see you in the next one.